Hi, my name is Natalie Wilson, and I am a 20-year-old college student at Texas State University. I'm from a small town called Wiley, which is a northern suburb of Dallas. And over here, I do have the questions just kind of listed out for me so I can hit the checkpoints throughout the video. But we can go ahead and start with question number one. For question number one, I want to talk about a personal experience that I had in the south of France. On vacation one year, me, my father, and my little sister were in Nice, where my father suddenly fell into cardiac arrest and shortly after passed away. So during this time, I wasn't able to speak with healthcare providers, nurses, doctors, just to know anything about my father's healthcare status or what to do next in a foreign country away from family. It was terrifying. And as a future healthcare provider and an aspiring nurse, I desire to be well-rounded to take care of patients who were like me, who needed someone to be there for them and guide them through stressful emotional times, which is often accompanies healthcare situations. So no matter how small, how big the moment is, being able to provide for any patient culturally, in any language, there's so many things to choose from whenever it comes to diversity. But all that matters is that you need to be well-rounded enough to take care of the people that trust you. Yeah. So for question number two, as to why I chose Texas State Nursing School, I chose Texas State Nursing School because you guys offer an amazing program, one of the best in Texas, where you guys give your students such vast knowledge to where y'all have an amazing NCLEX pass rate for your students, preparing them for the real world of becoming a nurse. You guys, I'm trying to get the words. You guys offer a hands-on program where you guys, it's comprehensive, it's collaboration based, where you get everything you need to become the well-rounded nurse that we were just talking about in question number one, making you the best you can be, as trusted as possible with your patients and with your peers and co-workers to make you be the best. And you guys offer that. You give your students that opportunity to become the best. And that is why I want to be in your program. Some things that I've done to help prepare me for the Texas State Nursing program is I have done a 6-month CNA program where I got clinical healthcare nursing experience inside and outside of the classroom. As well as this, I've luckily been given the opportunity to have a bunch of shadowing opportunities at Baylor Scott and White in Irving specifically, because I know Donna and she's the director of PT there. As well as this, I have been a hospice volunteer for about 6 months now, and this helped me really practice on my collaboration skills and getting to know the patient on a more personable level where they can trust me. And I just learned how to talk to a lot of the times people in a geriatric community, but it just taught me how to care more and connect with patients who need someone, which will be so helpful later on in nursing school and beyond nursing school. So question number three, moving on, is some strengths that I have that I can bring to the table for Texas State Nursing. Some strengths do involve some of the things I just previously mentioned, like such as my experience in healthcare already, where I have my 6-month CNA program completed. I've had my BLS CPR first aid for about 5 years now, since I was a lifeguard as an itty bitty 15-year-old, right? As well as this, my volunteer hours have taught me, as I mentioned, communication skills and how to be more personable with patients in a time of dire need. And some other things that I bring to the table include my academic preparedness. I've maintained an excellent GPA through my past 2 years in my undergrad for nursing school, being able to time manage, being able to balance the importance of things that are happening in my life, to prioritize school first, yes, but also being able to prioritize things such as my mental health, my body, my wellness, my friends, things outside of a curriculum inside the classroom. Because I am very happy, I've made friends, I've aced my classes. Everything that I've come to know for time management is huge, and I think will help me a bunch within Texas State Nursing School. As well as this, I've had the opportunity to join 2 amazing clubs at Texas State, one being Women in Science, 2 being HOSA. They are amazing, and I get to practice communication skills with peers with similar interests on a weekly basis. I'm just growing personally, and I'm growing as a healthcare provider. I'm gaining more knowledge than ever, honestly. For question number 4, this one was interesting. Personally, for this situation, I would first just take a deep breath and calm down and pull off to the side of the road, ensuring the safety of myself and the others around me. That is the most important thing, is safety first. And then after safety has been completed, we're going to move on to seeing if there's any way that I can make it to that exam. I know my check engine light is on, I know I'm out of gas, but we're gonna try to make it. We're gonna try to Uber, we're gonna try to call a friend. If this is not possible, which it probably is not possible, we're contacting our professor almost immediately, letting them know of our absence, and then working later on to see if there's any way to reschedule this exam, because we know how important exams are. And then we're gonna take preventable measures from here on out. We're gonna make sure I'm maintaining my car and doing all the necessary things to never miss an exam again. But yeah, that would probably be what I would do for 4. For number 5, what am I going to do to get through the 5-semester program? So some things that I'm going to do to get through this 5-semester program include, for the past few years, I've been making sacrifices, and I've been able to come up with long-term plans to get me through this 5-semester nursing program. This involves personal saving, this involves a lot of financial help from my parents, yes, to come up with a budgeting plan that will get me through 5 semesters of nursing school. Nursing school is going to be a #1 priority above everything else, because this is what my future foundation is going to stem from. So having a financial budget that's going to carry me through and get all my critical care needs set aside is going to make me feel confident in school and confident in my ability to time manage other things outside of financial necessities. I'm very lucky and blessed to have this help. So I've prepared for 5 semesters of nursing school. So that is basically all I have for you guys. I'm really thankful to have this opportunity to get an interview and tell y'all more about myself. And I hope to see y'all this fall. Thank you.